Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to go over an exercise we call the hip 90-90 lift. Now, there's two variations or slight variations to this exercise. Ones that we use to be able to help create a little bit more hip motion and mobility, and one that we use just to kind of stabilize the core, the pelvis, and the hips to be able to reduce pain. So I'll cover both of those, but making sure that you're using the correct variation is going to be really important. So in order to do this, what we're going to do is we're going to need a box. You can use like an ottoman or the side of a couch or a weight bench, just something that gets kind of like hips and knees to 90 degrees. We're also going to use a yoga block. This is what we use in the office, but if you don't have a yoga block, you can always use like a small foam roller or even like a small pillow to be able to place between the knees. But for the sake of the video, we're just going to stick with the yoga block. So what we're going to do is we're going to lay on our back. Now, the important thing for the setup for this is I want to make sure that my hips are at 90 degrees. So I want to make sure that I'm sliding my hips down to be able to keep the angle between my hip and my knee pretty much at 90 degrees here. And then also about 90 degrees on the box with the knees, okay? I'm gonna place that block or the foam roller or small pillow between my knees and give it a little bit of a squeeze. Not so much that we're like really kind of tightening, just enough to kind of start to engage some of the inner thigh muscles. Then what I'm gonna do is if I'm going for back pain relief and just helping to stabilize the area, I'm gonna get that belly breath in, create intra-abdominal pressure, and then I'm gonna push through my heels and then lift hips up just about an inch or two, just to be able to feel it in my hamstrings, stabilize my core, and feel it slightly in the glutes. I'm gonna hold that for 3 to 5 seconds and then allow it to come down and reset. If I'm going for an increased hip mobility and I don't have any back discomfort, what I'm gonna do is I'm going to tilt my pelvis and blow all the air out. So I'm creating a little bit more space on the back side and a little bit of kind of compression on the front side where we're trying to shorten to allow that pelvis to rotate. And then I'm going to lift up slightly to create more of that decompression in that area and create more space within the hip itself. And same thing, holding for 3 to 5 seconds and then allowing yourself to come down. So this can be used for either, and that's why it's really important to make sure that you're working with a provider who can guide you on which variation to use and which one would be best, as well as modify it slightly just depending on how you're feeling and how it's changing either stability or increased range of motion and mobility. So that's the hip 90-90 lift. If you have any questions, feel free to drop them in the comments, and yeah, thanks.